Bartholomew Jackson. He has been struggling with very low levels of collagen as we tested him, as he has complained about having very weak bones, and he has fractured multiple throughout his childhood. We have noticed blue eyes, a little bit of hearing loss. As you can see, this is a demonstration of our patient's spine. You can see as he's suffering from major scoliosis. We've had to deal with that multiple times, and we hope it doesn't have to come to surgery. He has suffered a fractured bone in his posterior brachial. He has also had to get reconstruction, taken multiple x-rays, and as I can see here, his bones are not bending in ways they should. They are bending left and right, and they're very weak and brittle. As you can see from his fragile and brittle bones, our patient actually was slammed into a wall very lightly, but still shattered his scapula right here, and that's not normal. Usually the body can take forces of pretty extreme measures without breaking anything, so this is something we've looked at. One of our first tests that we ran on Bartholomew was a bone density scan. After the results came back, we were kind of shocked to see this, but his bone density was very low, and we saw very weak bones, and we immediately thought the lack of collagen. So we did some more research, and we did a collagen level reading, and we saw that his collagen levels were very low or very poor quality. One of our first tests we ran on Bartholomew was a bone density scan, as we saw multiple fractures in his early childhood. We measured for collagen levels as well, but we were shocked by the results of his bone density scan. He came back with a negative 1.5%, which is extremely low, and most normal levels are about negative 0.5 to negative 1. So our patient is suffering. It's one of our follow-up testings we had to do on Bartholomew, since his less dense bones. We had to test him for his amount of collagen in his body. He came back with very low levels of collagen, and the collagen he did have were very poor quality. As our patient has suffered from scoliosis for most of his life, we did an x-ray a while back of his back, and we can see here that it's curved outward and to the right. He has been struggling. He cannot play in sports because of this, and we have considered surgery, but we don't really know what we're gonna do yet. We just have to consult with his father and his parents first. His scoliosis is affecting him in many ways. It's showing us more that this is a bone disease more than anything, but we have to get to the bottom of this.
After running several tests on Bartholomew, we found weakened femur bone and tibia. We surgically went in and placed rods and screws both in the femur and the tibia. By doing this, he should experience less pain during activities.
Our patient's father here, Stonewall Jackson. Stonewall, how have you seen the scoliosis affect him at home?
He has had trouble getting out of bed in the mornings, and a lot of reduced activity. He hasn't been able to do much. He's been laying down a lot more than walking around and being active, and he was pushed into a wall at school.
And this fracture of the scapula we saw, how hard was he pushed?
He was not pushed very hard.
So this was should have barely been a bruise, but yet he fractured his scapula.
Yes.
That's interesting. So other than that, the reconstruction of the tibia bone that we saw from a 2-foot fall from a platform, why do you think this happened? Was it like a bad fall or just?
No, he took a tumble off a very small platform and snapped his leg. I was very surprised. The bone came through the skin.
Compound fracture.
Yes, we rushed him to the hospital.
And where my surgeons performed reconstruction of his tibia bone.
Yes.
Which took multiple hours and a couple of surgeries actually.
Yes.
He also, I see, was rushed to urgent care when he was about 6 years old he broke multiple bones in his posterior brachial. Why was this?
He got punched by his older brother.
So you're telling me that he broke a bone from a punch?
Yes.
I think I might have a diagnosis. So as we have concluded our test and we've considered many different options of what Bartholomew can be suffering from, we've came to the conclusion that he was born with type 2 osteogenesis imperfecta. He has this is the reason for his very easable breaks and very low levels of collagen. He has developed a hearing loss from this, and he has a blue tint, which are all very common symptoms of osteogenesis imperfecta. Without the collagen, normal levels of collagen in his system, Bartholomew's skeletal system is very, very weak. He suffers from brittle bones, and since the collagen is not in his system as one of the most important proteins, his body is not getting the nutrients to replenish and keep his strength as a regular person would. His lung, he has started to develop respiratory infections from this, as we've seen with other cases of OI, and these can sometimes lead to death, so we have to watch this very carefully. The reason we're starting to see respiratory problems are usually because it's more of a severe case of type 2, which we are starting to see. The collagen defect affects the lung tissues and actually can cause very commonly lung infections of the patient. He has broken several bones in his lifetime. He has a bluish tint to his eye, which is a common symptom. Damn it, fuck, I didn't say so. He has suffered a fractured bone in his posterior brachial. He has also had to get reconstruction of his tibia. That's not the tibia. I can see here his bones are not bending in ways they should. They are bending left and right, and as they're very weak and brittle.
Whoa.
You're interrupting me. Are you kidding me?